Let's talk about the benefits and dangers of testosterone supplementation for men. I'm Dr. William Starsiak. Now, I've had a few patients come to me that when I check their testosterone levels, the doses other physicians had them on are putting them up at 1,500 for total testosterone. This is crazy. This is not physiologic. The most generous upper limit is 1,200, but some labs will actually put the upper limit at 800. So why are people doing this? You know, doctors are selling people this narrative that as a 50-year-old man, you should be over 800. And that's just crazy because the average for a 35-year-old is around 350, 400. Now, we could say that our environment has some toxins present in it and our lifestyle, those combined, they lower our testosterone level a little bit. That makes sense, but not to the tune of 1,000. Like, it's crazy. It's not normal for us to be that high. And you can just look at the number of pending court cases out in the United States where you have cardiovascular disease, heart attacks, strokes associated with testosterone treatment. There are something like 4,000 pending court cases for this. You can look at research showing that older men, especially once men get into their 70s, if they have higher testosterone levels, if they're in the 800s or higher, they're more likely to die sooner. So what is a good level? Well, if you're down around 200, everyone agrees that that's low, and supplementation will make you feel better. But what will the difference between going from 200 to 600 versus going from 200 to 1,500 be? Well, you're going to be plenty happy going to 600. You're going to have more energy. You're going to rest better. You're going to recover better. You're going to have more sexual desire, more interest in intercourse. You're going to get stronger because you have more energy, you can exercise better. Even if you don't exercise, you'll put on more muscle mass. But you also will likely put on more fat if you don't exercise because testosterone will increase your metabolic rate and it will also make you more hungry. So it's not like it's gonna make sure that you get lean. If you want to get lean with testosterone, you also have to exercise. You still have to lift really heavy. If you just want to put on muscle mass and not have to work very hard, then you need to take something like nandrolone. But that's a little bit scarier compared to bioidentical testosterone. So just know what you're getting. Know why you're getting what you're getting. Because if you're going up above 1,200 or even around 1,200, you're going to get more conversion into estrogen. So if your practitioner is putting you on an estrogen blocker while you're doing testosterone supplementation, that's because he's taking you supraphysiologic. He or she is taking you to a range where if you imagine testosterone like a pond, and that pond has two outflows. One outflow is conversion into estrogen via aromatase present in fat cells. The other outflow is conversion into dihydrotestosterone. So if you get more estrogen, well, you can develop breasts if you get enough of it. You can also become more irritable and have mood swings. That's the real reason for roid rage, not just the testosterone. Now, if you're getting too much conversion to dihydrotestosterone, you can start to lose your hair. So if you're going that high, you also need to make sure you use a DHT blocker. Natural ones are like saw palmetto, nettle. The best one that is prescription is dutasteride, but there is some concern with prolonged loss of libido with dutasteride and the more popularly known finasteride. And then you also have like minoxidil, but that's a different mechanism, so that won't block the formation of dihydrotestosterone. So like everything in life, everything is a balance. There's a cost and a benefit to every choice that we make. If we choose to go too high with testosterone, the cost potentially is our health, where we could get a vascular issue, but we can also suppress our own testicular production of testosterone to the point where if we stop, we may not ever recover it, and we may be dependent upon testosterone for the rest of our life if we go too high and stay too long. Additionally, we can actually make ourselves infertile if we go too high and too long. So the best approach, in my opinion, is first start with trying to tone our natural production through improving lifestyle and using some of these herbs that we know increase testosterone. Ashwagandha, Tongkat Ali, Shilajit, Vidari Kanda. These are all really good options to begin with. And then if that's not enough, we can supplement. But if we take someone super high really quick, what we're going to do is desensitize receptors. So we're going to need more to get the same response that someone with less gets. And we're going to maximize our side effects. We're going to start getting acne, we're going to get the irritability if we don't block with a aromatase inhibitor. We start getting hair falling out unless we block with dihydrotestosterone enzyme inhibitor. Going back to this idea about desensitization. If you go to a concert and this concert's really loud, when you come out of that concert, if someone whispers next to you, you will not hear what they say. But if you're in a room where everybody's whispering and it's very quiet, you're in an art gallery, and then all of a sudden someone blows a foghorn in your ear, it's extremely loud. So this idea of desensitization shows up with everything. If you drink alcohol every day, you kind of need more to get the same effect. If you smoke marijuana every day, you eventually need more to get the same effect. If you take opiates, you eventually need more. You desensitize the receptors the more you give them. So that's another reason going too high with testosterone doesn't make sense. When you're using a topical or a troche that dissolves under your tongue, or you're using injectable, you can always adjust that dose. Injectables, some will stay in your system, half-life of 7 days, so it doesn't totally leave for 35 days, and it's pretty much out of your system by that point. But you can also get shorter half-life ones like testosterone enthetate, which is it's a day or two half-life, so it's out of your system within a week. Those you can adjust dose and you can correct. But what people are doing now is they're doing pellets. I had a patient in his late 60s who is obese and was at a testosterone of 1500 because he had pellets in. But we measured his levels weeks after. It was like 2 weeks after he was supposed to have his pellets replaced. So if this guy's at 1500 weeks after these pellets are supposed to be replaced, what was he in the first few weeks, right? It's crazy. And people don't know this, and doctors are pretending like this is normal for people. And it's absolutely not normal. It's potentially very harmful, potentially fatal. So just be sure to do your homework and just be mindful of the fact that everything's a balance. Do you want to burn bright, or do you want to burn long, or do you want to find balance in between those two? And I would always counsel balance. All right, thank you very much for taking the time to listen to my video. Hey, if you want to work with me with your testosterone replacement or maximizing endogenous production, there's a lot of really good options out there, and I'm happy to educate you on all of them and help you in making the best choice for you.